Hi, everyone. Welcome back to the hashtag #CArthritis Facebook and Twitter live event here at this year's Canadian Rheumatology Association and Arthritis Health Professions Association annual scientific meeting taking place this year in La Belle Province in Quebec City. We're so thrilled to be back with you. I don't know, I think we're on interview number 17 or 18. And we're really getting into the juicy part of our interview schedule, and we have a real superstar sitting next to me this afternoon, Ms. Trish Barbato, who is the president and CEO, of the Arthritis Society, a very important partner to Arthritis Consumer Experts, and our co-host, Arthritis Research Canada. We both power the Arthritis Broadcast Network and this event. So super happy that you could be with us, Trish. It's such an exciting time, I think, in arthritis, or more specifically for this conference, rheumatology, both clinical practice and science, as well as bench and community science. So lots of cool things going on. A lot of the research being presented is actually research that you funded through your incredible efforts of fundraising and the public, who actually helps power so much of that research. So thank you so much for being with us.
Yeah, I'm so happy to be here, Cheryl. I'm delighted.
So this is an easy interview. I'm going to ask you to help knowledge translate what's happening at the Society and bring it right out to our Arthritis Broadcast Network community. There's so many wonderful things that you're heading up. Some of the really positive and dynamic changes that I think that have taken place at the Society over the last couple of years. And so just sort of over to you. Why don't you share with us kind of this current snapshot of the Society, what you're doing, where you're going?
Yeah, sure. Yeah. That sounds great.
Yeah.
Well, I'm really happy about what we've accomplished in a few short years. And so I'll just highlight some of those things that I think are most relevant to your audience. We have invested a lot more in research, so almost 70% more in research in the last 3 years. I remember when I came, we were investing about $3.5 million years ago. This was in 2020, and I just thought that is abysmal. You know, it should be 35 million. It should be 350 million. And so at least it's moving in the right direction. Yeah. We're at 5.9 million for this year. With a projection in 2 years to get to 8.9 million. So these are really gigantic steps that we're taking to invest in research. And I think it's so interesting what you said at the beginning. There's this beautiful, holistic, I visualize this circle, that just kind of is really interconnected, because you've got patients, and patients are also part of the research, and they're part of the advocacy, which is work that we do, but they're also donors, and they contribute their time, both in money, resources, and their experiences and
data,
that sort of thing.
Data,
research, everything. Yeah. So it's like this whole circle is very interconnected and interrelated. Yeah. And I really feel that when I come to these conferences. It's really amazing. So research is a really important piece, and we're really happy about that. Another thing that we measure is reach. And we measure reach we get these little facts from our organization from different places. So for example, we measure the people we actually touch. So that could be through summer camps for kids. It could be, we have a large clinical program in Ontario that's free for people living with arthritis. We have modules on our website where we know that a person has actually completed a module. Yeah. We have arthritis talk. So we add all this up. And again, we were looking for not just incremental, but really significant increases. So we went from about 1.2 million, we'll be up to 2.8 million in that kind of reach to people living with arthritis and interactions by this year. And I want it to 4 million kind of by 2025.
I love it. You put out big goals, and you're getting there. I always say, if you don't stretch, you're not going to get more flexible.
Correct.
Right?
Yeah, correct. So we're really, I think that's it. I think that's really well said, Cheryl. Yeah. I feel like we have to stretch way more than we're stretching now. But I also don't want to make it so completely unrealistic. But my stretch would be, as I said, right? I really want research to be at 100 million. Yeah. So that is a huge stretch. That is going to take a bit of time to get there. But I really think it's important that we are a major fundraiser and a major advocate with the government around all of the needs of people living with arthritis. Like we have to be able together with the ecosystem, put our shoulder behind a few things and get them done. Like I'm just like done. I'm done with how long people are waiting to be diagnosed. I'm like done with all like people not having access to medication for things to cost too much. Like there's so many rheumatologists. I was just in a conference. Now I'm going on a rant.
That's okay. Rants are good here in the booth.
I was just in a session where a rheumatologist said that he used to triage and he had his high risk that he had to see, and he tried to see those within 4 weeks. Well, guess what? Like he's completely booked. Everything is high now, so he can't even get to the folks that he has that are down the line that probably still need to be seen.
And this matters because we know through science, some of which you have supported through your incredible grant funding stream, we know that for people living with diseases like mine, rheumatoid arthritis, that there is a window of opportunity to optimally suppress, eradicate, kind of stop the disease's impact on a person's life. So these kinds of issues around weeks of wait are critically important to real people out there on the street.
Yes, I agree. Yeah. I keep ranting. And we have a growing number of the group with kind of autoimmune or inflammatory arthritis. So we're sitting in that 300,000 to 400,000 mark in Canada. It's a huge number. And I guess, and I'm also, another thing I'm done with, is that nobody even knows about that group. People don't understand the inflammatory arthritis side. They keep, there's all these myths that it's an older person's disease and all kinds of things. It doesn't affect young people. And so I think that we have so much work to do to raise awareness, and that awareness building will help us launch stronger proposals to government around increased funding and partnering around more research and helping with some of the systemic issues that are faced by patients every single day.
Yeah, well, we can get behind that big time.
We are doing it together.
We are doing it together. I mean, it really does take a village to make these things happen, but you need some strong villagers who are willing to be brave, sometimes make people uncomfortable with some of the challenges you're putting in front of them, through words.
Yes.
And then seeing the action stack up behind that. So I wonder, you talk about this fantastic increase in research. You've changed some of the way you're doing business. You're taking this more action-oriented and more innovative approach, I think, towards the way you're doing the research granting process. Can you tell us a little bit about that?
Yeah,
I'm thinking of the innovative, the innovation grants, things like that.
Yeah, so I love innovation. My last role was in innovation. So when I came to Arthritis Society of Canada, I had a strategic plan handed to me. It was already completed. And of course, I flip through it and I say, where is the innovation? There's nothing in here. So I ask if I can revise it in order to inject another pillar, which is innovation. And a couple of things that I'll say about that. I'm really pleased that during the pandemic, so many charities that relied on events kind of couldn't get anything done and were really worried. But we launched all kinds of things. Like we launched 8 new programs during the pandemic. And one of them was our Ignite grants. So these are research grants that are high risk, high reward. It means that they do not require preliminary data. They are also evaluated first on their innovativeness versus their scientific merit. Of course, the scientific merit is important, but you're opening up the possibility of something that's breakthrough that could then, yes, it might need a more standard grant and other things, but let's just see what we can find. So there's those grants, which we're really pleased about, and we're getting lots of great applicants. So that's fantastic. We have another pillar around social impact. And the way to think about this is, and I could rant again, so many things that are left on the research floor, on the lab floor, that are too hard to translate and scale. And this is a problem in all of Canada. We don't have a startup problem. We have a scale up problem. We have a problem in getting things out. The social impact pillar is about taking ideas that really make sense and to help be a lever to push them forward so it gets to the intended user. So right now, the project, we have one project on the docket. I would like to see many more, but we're starting with one. And this is the prevention of osteoarthritis, because we screen babies for hip dysplasia. If a baby is not screened properly, has hip dysplasia, they will go on to have osteoarthritis early in life. It impacts everything. We also see higher prevalence of this in communities where they're already challenged to access healthcare.
Mm.
They have much higher incidence of this being missed in the baby. It's a very easy fix, 12 weeks, little brace, boom, they're good. We have prevented osteoarthritis. So this idea of screening ultimately nationally for this is something that we really want to try to achieve.
It's so commonsensical too. I mean, everyone in the audience gets on board with this, right? Yeah, let's prevent arthritis at the infant stage. Good idea, right?
Yes. Well, we heard Dr. Young talk about even the idea of, to your point, of getting that treatment early on in a child with juvenile or idiopathic arthritis and curing them. Essentially,
words that were never used at the start of my 33-year-long journey. I mean, I'm only now hearing that word, and it's so exciting because I think most people like me, Trish, don't want the next generation walking in our footsteps. We don't want them to have any kind of change to their life because of the disability brought on by the various types of arthritis. So amazing research.
And then we're also doing something called the Ideator program, and this is also really exciting. I like working with entrepreneurs, and I don't think enough entrepreneurs know about the problems that need to be solved within arthritis. So partially we are trying to get out to universities and college and innovation hubs to let them know, hey, we are a problem that needs, like, people have problems that need to be solved. So we have awards that happen annually. We ask for entrepreneurs across the country to tell us about their product, their technology, their app, their anything that could help people with arthritis. We screen for these. We test them with our innovation ambassadors, people living with arthritis. And then we have finalists that go to the event in Toronto in April, and there'll be 4 prizes.
Kind of like an Arthritis Dragons Den.
Yes, exactly.
I love it.
Arthritis Dragons Den.
Love it.
And it's going to be great. It's really going to be great. And I love that last year we did a People's Choice Award. So anyone could watch the videos of the entrepreneurs and startups and vote on the one they were most interested in, that they wanted to win. And we had almost 4,000 votes for the People's Choice Award. That's amazing engagement.
It is amazing.
Yeah, really amazing engagement.
It goes to show you that people with arthritis, they know what their problems are.
Right.
And when they see that, because they live with them every moment of every day, and when they see an idea, they think that might address, like, that's real. That's real review in real time, which is amazing.
Yes.
Wow.
I agree.
Incredible. So we're now coming up to this next phase, coming into so when do people who are given these awards, when do you start hearing some of the results? I mean, research does take time. We will, remind people that.
Yeah. Well, we keep track of them because we're also trying to help them in other ways.
Okay.
I have a network with private equity, so sometimes it's money or sometimes it's access to different things. So we really try and just help them along the way. And then they do have a report back that we'll do by video in the next. So every year they kind of report back officially as to how their investment went. So there's some level of accountability.
Yeah.
And also a way for us to, evaluate, were we too early in that investment? Was it too late? Essentially.
If I might, I'll say one other thing about the Ideator program itself. Is meaning you, obviously through leadership, but also the Arthritis Society, you're actually educating, your knowledge translating to groups of people, like you said, that really didn't know arthritis existed, or that what they knew about it wasn't actually correct, as business leaders themselves.
Yes.
And you're opening up their imaginations as to how they could partner with arthritis, which is no one else has done it. And I mean, we're obviously much smaller grassroots organization, but I think that's why there's good synergy, because it's about the big idea, and sometimes the big idea that seems a little not so usual is the winning idea, and that captures people's imagination, and people financially will get behind it.
Yeah, I agree.
Right?
Cheryl, we are so aligned on this. I think we talked about it one of the very first times you talked about it. And perhaps that's just a good segue to say that I think the future is bright. because there's just so much happening right now, and I think we can all collectively play a real leadership role to raise awareness and really put arthritis on the map where it must be. It has such an impact economically on the country. It has such an impact in terms of the healthcare system, in terms of costs, in terms of so many things. And it's like, it is our time.
Not to mention the incredible personal burden that someone lives with.
Day in
So
and day
you
out.
bring those two pieces together and the dollar signs are enormous around in terms of cost.
Yeah, exactly. Exactly. Mental health, like everything. There's so many things that impact.
Everything. And we're very much touching, if we're Venn diagrams, we're overlapping other chronic diseases, heart disease, diabetes, obesity. Like there's a lot of areas where these health diseases, conditions meet together. And if we can get energy going into solutions around ours, we're also lifting up these other areas of health as well.
Agreed.
Yeah.
And think of the numbers, the sheer numbers, like millions of Canadians.
Yeah.
So there is just still so much to do, but I think we're all collectively on the right path.
Yeah.
And I think that articulating some of those big, bold goals and as a group getting some alignment around it and really engaging the broader group of stakeholders and people living with arthritis, I think we can come to something super compelling.
Yeah, the moonshot.
The moonshot.
The moonshot.
We need the moonshot.
We need the moonshot. Well, I always love talking to you, kiddo. Amazing energy, amazing things going on at the Arthritis Society. Arthritis.ca is where you can find them online all day, every day, all hours of day and night. There's opportunities to volunteer, to donate, obviously, to get behind some of these incredible programs that Trish has been sharing with us. Any questions from the audience, Anita?
Just one quick question.
Okay.
For people who want to keep track of those research studies that you talked about, is there a page on the website that lets people know what's happening when and when?
Yes, there is. There's both a section on competition, so if people are interested in actually looking at putting a submission in for a grant, there's also a section on summaries of all the research that we fund. So there's a couple of areas under that.
And then, of course, that knowledge the society is putting into its own education information programs, right?
Correct.
That is, I mean, that's the icing on top of the cake, really, is that science, the very science that you fundraise for, that you invest in, that you monitor, then you're able to quickly communicate it out to the public who benefits from it ultimately.
Yeah, correct.
So there you go, people. This is just a very small taste of what's happening at the Arthritis Society. We're so grateful to you, Trish, for coming in and sharing with us this afternoon. We wish you well, and we want you to tune back in. Our next interview is with Dr. Nigel Haroon, the president of the Canadian Rheumatology Association. See you soon.